care certificate is the 15 national standards that a healthcare assistant completes. It is either in a booklet or online.
You'll be assisted by another qualified staff and they will guide you through, so then it gives you confidence.
It involves lots of learning through different topics. Some of them are kind of clinical based and others are more sort of theory, things like equality and diversity, and then you've got your clinical areas like infection control and resus, nutrition and that sort of thing.
It's just to ensure that all the healthcare assistants work to the same level within their role.
Effective patient care is extremely important because each patient has their own needs and everyone's needs are so different, so you need to tailor everything you do to that person's needs.
It's important to listen to the whole story that the patient tells. So like you might be in a consultation and it might be about a particular illness they have, but then they also happen to mention that they care for their partner who's had a stroke recently, and that, to me, effective patient care would mean also just making sure that that's okay for them and they don't need any more support.
Making sure that observations are on time, all the paperwork's up to scratch, so if someone is looking after that patient because you've had to be rushed off or you've got the day off the next day, that they can go back and refer and see everything that's up to date with that patient, so it is self-centred.
If we don't have a good communication, you can solve the problems.
If everybody's singing off the same hymn sheet, you know what is best for that patient. Everybody has to be providing the right care for that main individual. Good communicating with the patient's families also helps, because they have a big role to play in that patient's recovery as well outside of hospitals.
I really value the fact that we all meet together every morning and the sisters go through any changes that have happened that week, and they always say, who hasn't been here, who needs updating, and then if there's anything you miss, there's a book and a folder that we can go and look in as well, where it's all recorded and written down. So, but also they're just always happy for us to knock on the door and ask.
We've had some feedback before where it's like, this midwife said too many medical words that no one really understood. So it gives us feedback to know that we need to really simplify it and not use so many complicated words that actual people from the general public, they know and they understand, so then they don't go home thinking, I don't know what they said, I don't know what it means, that they just feel like, okay, I know what's going on, I know how to handle it, and I know what I need to do.
So it's very important, the feedback, no matter what it is, because we all need to learn. From everyone can learn something.
I always like constructive criticism to try and help develop me personally. I just think it's extremely important to then be able to deliver that patient care.
I think you need to be honest and open in the healthcare setting, so that everyone sort of knows where they stand, and that defeats the bad feelings that you could have amongst people. I think it's better to be honest if you don't know something, if you're unsure of something, so that it can be corrected.
They are here, they are poorly and they are vulnerable, so they do put all their trust in the people that are surrounding them and looking after them to get them through.
We all go through healthcare in our lives. We all have at some point to go to the doctor or the hospital, and I think it's really important that we trust the people that we're seeing and that we know that they're working honestly and that they'll say if there's a problem and own up when things go wrong as well. And I think most of the time people don't mind because we're all human, no one's perfect.
It's important to ensure that the appropriate information is getting to the patient, but also to the clinical staff you're working with. You just need to be honest about that patient's condition or how they may have deteriorated, and you've noticed that, and just escalate it.
What I'm doing is good for them and it's good for me in return.
Together,
We
Thrive.
Together we thrive.